Let's talk about ocular cicatricial pemphigoid. Well, the ocular means eye, cicatricial means scar and contraction, and the word pemphigoid is autoimmune inflammatory disease of mucous membrane. So here the definition of OCP, ocular cicatricial pemphigoid. It's an autoimmune blistering of mucous membrane resulting in scarring and contraction. Our own body makes antibodies against the mucous membrane of conjunctiva, mouth, esophagus, genitalia, anus, and sometimes the skin is also involved. So, the antibodies that the body forms as a result of hypersensitivity to cytotoxic reaction in which the IgG and IgA is formed, these two bad boys attack the mucosal surface basement membrane of the eye, the conjunctiva, and once they attack the basement membrane, there is activation of complement system and recruitment of inflammatory cells. All the defense system gets activated, and once it activates, there is these bad guys are going to break down the conjunctiva. As a result of breaking down of conjunctiva, there is formation of blisters that, that are called bullae, and these bullae are converted into ulceration. And ulceration leads to cicatrization, that's also called scarring or contraction. Well, the clinical features of this disease, OCP, is it occurs in females more than in male as a ratio of 2:1, and it affects at the age of 60 years. So old guys can have this disease OCP. And the clinical features are seen in three parts of the eye: conjunctiva, cornea, and iris. In the conjunctiva, there are red eyes. Conjunctivitis is very resistant to topical therapy. No matter how you treat this disease, but you are not going to resolve conjunctivitis. And there is subepithelial bullae ulceration, cicatrization, fibrosis. That's the diagnostic point. You can see gray, white, linear opacities in the eye, and the eyes become very dry because there is loss of goblet cells, accessory lacrimal glands, and there is occlusion of lacrimal ductules. And there is shrinkage of fornices. The condition is called symblepharon when the palpebral and the bulbar conjunctiva stick together, and the upper and lower eyelid also get attached to each other, and that's called ankyloblepharon. And the second clinical feature, the diagnostic feature we can see is in the cornea. We can see limbal epithelial damage that leads due to keratinization and conjunctivalization. And the second important thing, around the cornea we can see new vessels uh, forming up, that's called peripheral corneal vascularization. And in the eyelids we can see blepharitis, trichiasis, and entropion. You know what trichiasis is? It's the touching of one or more eyelashes to the eyeball, and entropion is the inward flip of your eyelid margins. And at the end result of this disease, we can see three main clinical features. If you see these three, you can diagnose this condition as OCP, ocular cicatrization pemphigoid, and if the age is of 60 years, like, so you can see dry eyes, symblepharon, and the vascularization of cornea. And what you are going to do with this 60 years old female, you're going to give her artificial tears to correct dry eyes. You should give her cyclosporin to decrease the immunity so that her body can't do autoimmune reaction. And when you give cyclosporin, you reduce body's immunity and the chances of infection are high, so you also give antibiotics and to cut off the keratinization and conjunctivalization, you give retinoic acid, vitamin A. Thank you. Have a nice day. Bye bye.